Here at the WVU Heart Vascular Institute, we have a comprehensive atrial fibrillation center and a unique team of cardiologists, and specifically electrophysiologists, who are cardiologists of the electrical conduction of the heart, that have a multitude of both medical as well as catheter-based therapies to treat atrial fibrillation and manage atrial fibrillation, and surgeons that extend that one step further to the surgical therapy of atrial fibrillation, which involves ablation or putting in special lines inside the heart or outside the heart to attempt to stop atrial fibrillation and hopefully cure it forever. And the ultimate in those procedures is called the Cox-Maze procedure. Essentially, we create a maze so the conduction gets to the right spot properly without being erratic. Particularly over the last 5 years, we have participated in extensive work on robotic-assisted Cox-Maze procedure. And that is an operation for patients that have either exhausted existing therapies or failed previous therapies, medical or catheter-based therapies, or patients that have more than just atrial fibrillation. And the real special thing about the technique of robotic-assisted Cox-Maze procedure is that we can see the tissue lines beautifully and very precisely. And our position is that by doing it robotically, a surgeon now has 5 hands on the patient instead of 2. Of course, in the front, it's the surgeon with 2 hands. Robotically, we have a tableside surgeon and we have a robotic surgeon, and the robot has 3 arms. So with that, we're able to very clearly see every line of the patient's heart to make sure that those lesions get done precisely. And it is that precision that can be facilitated by this technique of robotic-assisted Cox-Maze procedures that provides that extra enhancement to assure the lesions are done well and thoroughly.